Hi guys, welcome back to the channel. In last class we have started maxillary sinus. We'll be continuing that today. Now coming to functions of maxillary sinus. What are the functions of maxillary sinus? First is warming of the inspired air, the air we take in. Then there is humidification of the dry air. Lightening of the skull weight. It lightens the skull weight. Resonance of voice, it helps in resonance of voice. It filters debris. Act as an accessory olfactory organ. Protects skull from mechanical shock. It acts as a cushion. Okay, it acts as a cushion, so it protects skull from mechanical shock. Production of bacterial lysozyme gives air padding to provide thermal insulation to adjacent important tissues. What it gives? It gives air padding to provide thermal insulation to adjacent important tissue, assisting in regulating intranasal pressure. It also regulates intranasal pressure. What does it do? It regulates intranasal pressure. So, warming of inspired air, humidification of dry air, lightening of skull weight, resonance of voice, filters debris, accessory olfactory organ, protects skull from mechanical shock, production of bactericidal lysozyme, gives air padding for thermal insulation and assisting in regulating intranasal pressure. Okay. Now, what are the applied surgical anatomy? Okay, what this term mean applied surgical anatomy? Applied surgical anatomy means what are its importance when we do surgical procedure, where we look for maxillary sinus or where it comes into an action when we do surgical procedure around it. Okay, so in relation of roots of the floor of sinus, okay, maxillary teeth root we should be considering during extraction. Okay, now low incidence of OAF in children. OAF is oroantral fistula. It has a low incidence in children. Okay, circumstances of increased likelihood of OAF when the age increases. Okay, periapical involvement जब ज़्यादा होता है तो भी, and periapical involvement also causes periapical infection. Sometimes if roots are in the maxillary sinus, it leads otherwise going into the sinus infection. Post-surgical paresthesia to maxillary teeth. Okay, when we are doing any surgery in maxillary sinus, sometimes it leads to paresthesia of maxillary teeth. Some antrum puncture. Fracture of middle third of face. Maxillary sinus plays a very important role in fracture of middle third of face, and we have also seen it act as a shock absorber. We have seen that, but we will dealing this middle third of the face in detail when we will studying trauma. I'll leave it. Now, oroantral communication is also an important thing. It is an iatrogenic. We'll dealing this in classification. Sinus lift is a procedure which is also applied anatomy. Will also deal with this sinus lift and foreign bodies entrapment. Okay, OAF, OAC and sinus lift. Sinus lift I am giving you a brief idea, but OAF and OAC will be dealing in detail with all their management, causes, symptoms, signs, everything in detail we are going to deal with. I'm also going to give you a brief idea about sinus lift. Okay, now classification of maxillary sinus disease. First is infection. What comes under infection? Acute maxillary sinusitis, chronic maxillary sinusitis, fungal sinusitis and odontogenic sinusitis. It is mainly an infection which can be acute, chronic, inflammation which can be acute, chronic, fungal or odontogenic. Okay, cyst can be extrinsic and intrinsic. What is extrinsic? Which is from outside, and intrinsic which is inside only. So extrinsic is OKC and intrinsic is mucocele and surgical ciliated cyst of maxillary sinus. Okay, bone dysplasia can be fibrous dysplasia, Paget's disease of bone, or it can also be ossifying fibroma. Sometimes ossifying fibroma is considered in benign tumors. Sometimes it is considered in this bone dysplasia. Okay, now coming to tumors, it can be benign and malignant. Benign, it is fibromyoma, hemangioma, papilloma, juvenile angiofibroma, ameloblastoma, osteoma. Okay, guys, you can remember some of these, not to mug up all this, just remember some of these. Some of the benign tumors of maxillary maxillary sinus, and some of the malignant tumor of maxillary sinus. Okay. There are also hybrid lesion when there is one side there is cyst and other side there is the tumor. Okay, this I have seen clinically, so I can tell you there is hybrid lesion also. There's a term called hybrid lesion. Malignant, squamous cell carcinoma, osteosarcoma, invasive tumor like basal cell carcinoma, salivary gland tumor like adenocarcinoma, and malignant lymphoma, in which non-Hodgkin's is more common. Okay. These are malignant tumor. Now trauma, fracture of midface we have done. Now iatrogenic, oroentral communication and oroentral fistula. We will be dealing this in detail. We'll be studying some of the sinusitis also. Some little bit we'll be dealing everything. But we will dealing oroentral communication and oroentral fistula in detail. Okay. This is all for today's class. Next class we'll be dealing about the general examination and some of the infection like sinusitis and all in the next class. Okay. Till then, like, subscribe and comment. Bye.